What really happens to your prostate when you masturbate every single day? Is it helping you? Is it harming you? Or is something else going on entirely that nobody is talking about? I'm a urologist with over a decade of experience, specializing in prostate health and male sexual wellness. And today, I'm answering one of the most common questions I get in my clinic, one that almost never gets discussed openly. What occurs within your prostate when this activity is performed daily? Here's what's wild. The answer depends entirely on your age, your technique, and your overall approach. And the research reveals something so surprising that most men never see it coming. Let's start with the basics, because most men carry real anxiety about their prostate without actually understanding what it does. Your prostate is roughly the size of a walnut. It sits just below your bladder, surrounds the tube that carries urine and semen out of your body, and produces the fluid that mixes with sperm to create semen. During ejaculation, its muscles contract forcefully to push everything through. It's a remarkably coordinated event, and as you'll see, it has massive implications for your long-term health. Now here's what nobody warns you about. As you age, your prostate naturally grows. By 60, half of all men have an enlarged prostate. By 85, that number hits 90%. And prostate cancer, excluding skin cancer, is the most commonly diagnosed cancer in men. 1 in 8 men will hear those words in their lifetime. So when we talk about daily masturbation, we're talking about a gland that's already under pressure from the moment you hit middle age. Now let's get into what the research actually shows. And this is where it gets genuinely surprising. A landmark Harvard study tracked nearly 32,000 men for 18 years. The finding? Men who ejaculated more than 20 times per month reduced their prostate cancer risk by approximately 20%, compared to men who ejaculated only 4 to 7 times monthly. That's roughly 5 times per week. If you're masturbating daily, you're already above that protective threshold, but it gets even stronger. An Australian study found that men who averaged between 4.6 and 7 ejaculations per week were 36% less likely to be diagnosed with prostate cancer before age 70 compared to men ejaculating fewer than 2.3 times weekly. 36%. That is a massive protective effect. Here's the biology behind it. Frequent ejaculation flushes out potentially cancer-causing substances from the prostate. Think of it like clearing a drain. When prostate fluid sits stagnant for long periods, harmful substances build up, inflammation increases, and cellular damage follows. Daily ejaculation keeps that fluid moving, reduces contact time between harmful substances and prostate tissue, and actively works against cancer development. But, and this is critical, the research is not one size fits all. For younger men in their 20s and 30s, very frequent masturbation may actually be associated with a slightly higher prostate cancer risk. Why? Researchers believe that men who are genetically predisposed to hormone-sensitive prostate cancer and who naturally have very high androgen levels at that age may face elevated risk. High ejaculation frequency in young men can reflect extremely high hormone activity, which might accelerate an existing predisposition. But for men over 50, the data flips completely. The protective effect dominates, and it becomes more pronounced with age. If you're over 50 and masturbating daily, the research strongly suggests you are doing something genuinely beneficial for your prostate, not something harmful. So what's physically changing inside the gland itself? First, fluid stops accumulating. Your prostate constantly produces fluid. Daily ejaculation regularly expels it, reducing internal pressure and inflammation. Second, blood flow improves. Arousal and ejaculation increase circulation throughout your entire pelvic region. Better blood flow means better oxygen delivery, better nutrient supply, and more efficient removal of waste products from prostate tissue. Third, inflammation goes down. Studies suggest regular ejaculation lowers inflammatory markers in the prostate. Chronic inflammation is linked to both enlarged prostate and prostate cancer. Reducing it simultaneously slows both processes. Fourth, muscle function is maintained. The muscles of your prostate contract during every ejaculation. Doing this daily keeps those muscles toned and functional, exactly like regular exercise maintains the rest of your body. I had a patient experiencing prostatitis symptoms, pelvic discomfort, urinary urgency, disrupted daily life. After increasing his ejaculation frequency to roughly once daily, his symptoms improved significantly within 6 weeks. The flushing effect and improved circulation did what medication alone hadn't fully managed. Now, while daily masturbation can be genuinely beneficial, there are critical mistakes that completely reverse those benefits. No lubrication. Daily masturbation without a proper water-based or silicone-based lubricant causes friction damage, micro tears, scarring, and progressive loss of sensitivity. This is non-negotiable at daily frequency. Excessive grip pressure, gripping harder to compensate for reduced sensitivity, creates a damaging cycle. More pressure causes more tissue damage, which reduces sensitivity further, which leads to even more pressure. Use a lighter touch and vary your stimulation. Rushing through it. Quick mechanical masturbation doesn't deliver the full prostate benefits. The arousal phase drives blood flow. The buildup phase prepares the prostate for complete emptying. Skipping these phases undermines the entire benefit. Take your time. Ignoring pain signals. If you experience pain, burning during urination, blood in semen, or difficulty urinating, stop immediately and see a urologist. These are real warning signs that require proper medical evaluation. The connection doesn't stop at the physical level either. Daily masturbation affects your mental health, and that indirectly but powerfully impacts your prostate. Ejaculation triggers dopamine, oxytocin, and endorphins. These neurochemicals reduce stress, lift mood, and promote deep relaxation. And here's the link most men never make. Chronic stress elevates cortisol, which increases systemic inflammation, including in the prostate. By managing stress daily, you're indirectly protecting your prostate from inflammation driven by your nervous system. One patient with high-stress work demands started incorporating this into his bedtime routine. Within 2 weeks, better sleep, reduced anxiety, noticeably improved mood, and decreased prostate symptoms. He was surprised. I wasn't. The mind and the prostate are far more connected than most men realize. So here's the practical framework I recommend to my patients over 50. Once daily is ideal for most men. 5 to 6 times per week is equally beneficial if that fits you better. Always use adequate lubrication, every single time without exception. Allow 10 to 20 minutes from start to finish. Don't rush the arousal phase. Vary your stimulation to prevent desensitization. Stay mentally present through the full cycle. Arousal, pleasure, release, relaxation. If you're in a relationship, this practice should complement intimacy, not replace it. And always listen to your body. If something changes, adjust. Now, it's worth being honest about when this becomes a problem. If masturbation is interfering with work, relationships, or daily life, that's a sign of compulsive behavior that deserves professional support. If you feel genuinely unable to stop despite wanting to, that's a recognized behavioral condition that responds well to specialized therapy. No shame in seeking help. The men who do are the ones who actually get better. But the vast majority of men watching this fall nowhere near those categories. Here's the bottom line. For men over 50, daily masturbation creates measurable, science-backed changes in your prostate. It flushes harmful substances, it improves circulation, it lowers inflammation, it maintains muscle function, and it reduces prostate cancer risk by up to 36%. Results that no supplement on the market can match. The research is clear. Men who ejaculate at least 21 times a month have a 20% lower chance of prostate cancer than those who ejaculate only 4 to 7 times monthly. Daily masturbation puts you well inside that protective range. The key is doing it correctly. Use proper lubrication. Take adequate time. Avoid excessive pressure. And pay close attention to what your body is telling you. Your prostate is changing every year you age. Daily ejaculation helps guide those changes in the right direction, protecting your health, maintaining your function, and giving you control over something that matters far more than most men realize.